This is sometimes called a membrane sweep. And this is a vaginal examination that might be offered late in your pregnancy. And the purpose of this is, well, it's an attempt to try and encourage labour to naturally start. Now, if they're going to work, they usually will work within about 48 hours, so you'll know if it's worked or not. Now, as with any procedure that's done, it should be done only with your informed consent. This means that you understand why they're offering the intervention, what will happen during the intervention, what the risks might be, and what the benefits might be, and what alternative options you have. They can only perform this, as I've said, I'm just going to reiterate it, when they've got your informed consent. So what do you need to know about it? So it's going to be your midwife or doctor who's performing the exam. It might be during a routine midwifery appointment, usually after about 40 weeks of pregnancy. It might be in the hospital, or it might even be something that's available in your area during a home appointment. During the vaginal examination, they'll use gel to help to make the exam as comfortable as possible, and they reach usually with 2 fingers to feel your cervix. Now, what they're going to try and do is see if they can insert a finger into your cervix. Now, if they can do that, they'll insert that finger through, and they're trying to sweep between your cervix and the bag of waters, or the amniotic sac. And they're doing that movement, basically, it's in order to encourage some prostaglandin release. Now, prostaglandin is a hormone that we think helps to trigger the start of labour, and sometimes we think the membrane sweep may well help with these prostaglandins being released. Now, as I said, it's usually offered towards the end of your pregnancy, or it might be offered a little bit sooner than 40 weeks if there's a particular reason that the doctor wants to be able to offer you that. And it is still an intervention, even if it is an intervention without drugs. It doesn't guarantee that it's going to induce your labour or start your labour, and there are some risks associated with it. The biggest risk probably is that you might feel quite uncomfortable, and it might even feel painful to you during the examination. Sometimes afterwards there might be a little bit of bleeding and maybe some uterine cramping as well. There will be other risks that your midwife should talk you through whenever they're offering you the procedure. If the procedure is going to work, as we've said, labour will begin usually within about 48 hours. And people have mixed views really on the chances of whether these stretch and sweeps are successful or not. So it is up to you whether you choose to ask for one or accept one if it's offered to you.